Welcome to Med School Drill. On today's tutorial, we'll be taking the cardiovascular system and we'll be focusing mainly on the right atrium. In our previous video, talked about the introductory aspects of the cardiovascular system, or simply put, the CVS. So just to make you remember what we did in the previous class, we talked about the chambers of the heart. The heart has 4 chambers. You have the right atrium, the right ventricle, the left atrium, and the left ventricle. If you're looking at this diagram, you will notice something about these 2 ventricles. You will notice that the left ventricle, which is on this side, is more muscular. If you look at the thickness of the muscle, is more muscular than that on the right side. And the reason for this is because the left ventricle carry out or is the main, it produces the main force which controls systemic circulation. Systemic circulation is a type of blood circulation that takes blood, take oriented blood from the left ventricle and to the aorta and supply it to the entire body. That's to the head, the leg, the limbs, the pelvis, the back, and everywhere. So the left ventricle needs to be highly muscular in order to produce higher forces of contraction. Okay, next thing we have here, we're looking at some notable features of the right atrium. Now, the first thing you have to note is that the right atrium is thin-walled and a low-pressure chamber. Note these 2 things: is thin-walled and is a low-pressure chamber. Looking at this diagram, you can easily notice that it's actually thin-walled. If you look at it here, you will see that the thickness of the wall is not too profound. The next thing we have here is that the right atrium, that's the right, don't forget, we're talking about the right atrium. The right atrium can produce a maximum pressure of 5 to 7 millimeter mercury. That is, and to get the maximum pressure in the atrium, you always see it during the atria, when the atria is contrasting. So if you are asked for the range of pressure in the right atrium to be from 0 to 7 millimeter mercury. The next feature we have here is that the right atrium houses the stenoatrial node, which is known as the SA node, and the atrioventricular node. Now these two what do I call them? These 2 parts or structures in the heart are very important in the conduction system of the heart. One very important and simple thing you should know is that the SA node is known as the pacemaker of the heart. Pacemaker, that is to say, it is the one who will set the beats, will set the heart into beating. It will tell the heart at what frequency it should beat. So when you are being told that somebody has a decreased heart rate or an increased heart rate, just know it has to do something with the SA node and the atrioventricular, which is the AV node. Now, this diagram will usually show you what I'm talking about. Now, the SA node can be located in the right atrium, as I've earlier stated. This is the SA node. This is the AV node, just directly below the SA node, but more close to the tricuspid valve. So when the SA node is being produces impulses, some impulses will move directly to the SA node and then move towards the other bundle branches, the bundle of His and the Purkinje fibers, and the rest. Why the Bachman bundle of the internodal fiber, which connects the SA node to the AV node, will take some impulses from the SA node and send it the to the left atrium, so that the right atrium and the left atrium can both contrast at the same time. The next feature we have to note is that the right atrium receives venous blood. Venous blood is blood that has no oxygen content, or has a very low oxygen content, or has an insignificant oxygen content. Now, the right atrium receives venous blood from two large veins in the body. The first one is the superior vena cava, and the second one is the inferior vena cava. The superior vena cava comes from the upwards. It will drain venous blood from the superior part of the body. Superior, that is the head, neck, the brain, the chest region, the clavicle, and all that. While the inferior vena cava will drain blood from directly below the diaphragm. So below the diaphragm, you can find things like your abdominal layer or region, your pelvis, and your lower limbs, and every other thing below the diaphragm. Now, the next thing you have to know is the coronary sinus. Now, this coronary sinus is not meant to be in this topic of discussion. It is more concerned with the coronary circulation, but I brought it here just to make you know that there's more to it. And this coronary sinus is found in the coronary circulation. It drains venous blood from the myocardium. The myocardium is the muscle of the heart. Now it drains venous blood from the myocardium of the heart and deposits it, or drains it, or supplies it to the right atrium, before the right atrium sends it to the left, to the right ventricle to the pulmonary artery, to the lung, and the circle continues. Now, what was saying, you can find them here. Now, if you look here, this is the superior vena cava. This is the inferior vena cava. I'm using blue because they carry deoxygenated blood. The coronary sinus doesn't show in this diagram because it is embedded in the myocardium of the heart. Venous blood entering the heart moves from the right atrium to the right ventricle via the tricuspid valve. Now, this is the tricuspid valve we have here. It has three cups, 1, 2, and 3. So this section is more like a transverse section. Let's say the heart is something like this, and I take a slice like this, a slice at the level of the valves. That's when you can see this kind of a diagram. So I believe we have come to the end of this video. Kindly subscribe. Thank you.